Hi, today we're going to be talking about proton pump inhibitors. Proton pump inhibitors, or PPI, are pharmaceutical drugs which are used to decrease gastric acid secretion. They are administered as interrogated tablets or capsules, which protects the PPI from being degraded in the stomach. The PPI travels down into the small intestine. Once absorbed, they have a short half-life, approximately 1.5 hours. They are lipophilic drugs that can cross plasma membranes. PPIs enter parietal cells via the bloodstream. The acidic environment of parietal cells causes activation of PPIs. This active form are usually sulfonamide or sulfonic acid, which inhibits the proton pumps. Furthermore, they consist of a substituted pyridine, which causes PPI to selectively accumulate in parietal cells. Proton pumps are integral transmembrane proteins that actively transport hydrogen ions across the plasma membrane. Proton pumps that are located in parietal cells play an important role in gastric acid synthesis. Thus, the inhibition of the pump reduces the production of gastric acid. The stomach contains a digestive fluid called gastric acid, which aids in the absorption of minerals. Activating pepsin, which is the enzyme that converts protein into peptides and destroys bacteria. Normally, there is a protective mucus layer that prevents the stomach from being self-digested. When the sensitive balance between protective and non-protective agents in the mucus layers is altered, it can lead to tissue damage in the stomach, thus causing peptic ulcers to arise. Therefore, proton pump inhibitors are commonly used to treat peptic ulcers and gastroesophageal reflux disease, GERD, to reduce the overproduction of acid. Parietal cells are located in gastric glands in the stomach. They are normally inactive, but activated in response to gastrin, histamine, and acetylcholine. The activated parietal cells can then secrete gastric acid. I'm going to give an overview of the synthesis of gastric acid and how proton pump inhibitors affect it. Carbon dioxide from the blood vessel diffuses into the parietal cell. Carbon dioxide and water are substrates for the enzyme carbonic anhydrase, which is denoted by Ca. Carbonic anhydrase converts carbon dioxide and water into carbonic acid. Carbonic acid dissociates into bicarbonate and hydrogen ions. There is a bicarbonate chloride antiporter located on the plasma side of the parietal cell. Bicarbonate is transported out of the cell and chloride ions are transported into the cell from blood vessels simultaneously. Chloride ions are transported into the lumen by conductance channels. Hydrogen ions exit the lumen by hydrogen potassium ATPase proton pump, which is located on the parietal cell. At the same time, potassium ions enter the cell via the proton pump. Proton pump inhibitors covalently bind to the hydrogen potassium ATPase pump on the luminal side of the parietal cells. This irreversibly inactivates the proton pump, thus stopping hydrogen ions from leaving the parietal cell, subsequently inhibiting the synthesis of gastric acid. The inhibition can last up to 2 days. The parietal cell must then synthesize or activate resting proton pumps to continue acid production.
PPIs have about 90% inhibition rate, therefore are known to be the most effective anti-ulcer drugs. However, PPIs can cause different adverse effects depending on how long the drug is administered for. Short-term use of PPIs can cause minor adverse effects such as headaches, skin rashes, dizziness, nausea, diarrhea, and abdominal pain. The cause of these side effects are not directly due to the intake of PPIs. However, further studies are needed to determine the mechanism of these PPI-induced side effects. Long-term use of PPIs can interfere with the absorption of iron, calcium, and vitamin B12. Iron and vitamin B12 are dependent on gastric acid secretion, therefore inhibiting the production of gastric acid by ingesting PPIs will decrease the absorption of these. PPIs may also decrease calcium and bone absorption, therefore increasing the risk of fractures. Another downside to using PPIs is that it inhibits cytochrome P450 enzymes, which is also known as CYP450 enzymes. These CYP450 enzymes are involved in drug metabolism. Therefore, inhibiting this enzyme will prevent metabolism and clearance of drugs. If another drug is administered with PPIs, such as warfarin, which is an anticoagulant drug, PPIs would inhibit CYP450, causing an accumulation of warfarin to toxic levels within the body, and therefore increasing the risk of bleeding. It is advised not to co-administer PPIs with acid-suppressing agents such as antacids, because antacids cause an increase in pH levels. However, PPIs can only be activated in acidic environments such as low pH. Therefore, if acid-suppressing agents are administered with PPIs, the PPIs will not be active and therefore not work properly.
Thank you for listening. We hope you now have a great understanding on the importance of the proton pump in acid production and the beneficial and side effects of using proton pump inhibitors. Thank you to Arthur and Julianne for using their creative skills to draw the pathway of gastric acid synthesis. We hope you enjoyed our presentation.